Anatomical and movement terminology. Planes through the human body can help exercise specialists describe a number of movement patterns. The human body can be divided into 3 planes of movement. Sagittal, which divides the body into right and left portions. If you bow to greet someone, then you would be completing this movement in the sagittal plane. Frontal plane, which divides the body into an anterior or front half and a posterior or back half. If you were to flap your arms like a bird, then you would be completing this movement in the frontal plane. Transverse plane, which divides the body into an inferior or bottom half and a superior or top half. If you twisted your torso to look behind you, then you would be doing this movement in the transverse plane. Anatomical position. Anatomical position is standing upright with an approximate shoulder width stance and the arms by the side with hands open and palms facing forwards. All reference to movement of the body is made with this position as a reference or starting point. The following are examples of common exercises and movement and their main plane of movement performance. Abdominal crunch, sagittal plane. Star jumps, frontal plane. Pirouettes, as in dancing, the transverse plane. Let's now look at common anatomical terms. Anterior means to the front. For example, in anatomical position, the toes are anterior to the heel of the foot. Posterior means to the back. The heel is posterior to the toes. Superior means towards the head. For example, in anatomical position, the head is superior to the feet. Inferior means towards the feet. The knees are inferior to the hips. Medial means towards the body's midline. For example, in anatomical position, the sternum is medial to the arm. Lateral means away from the body's midline. The arm is lateral to the chest. Proximal means towards an attached base, such as the torso. In anatomical position, the thigh is proximal to the foot. Distal means away from an attached base. The fingers are distal to the wrist. Superficial versus deep. Finally, we have superficial, which means near the body surface. For example, skin is superficial to bone. And deep, which means farther away from the body surface. For example, bone is deep to skin. Let's now look at movement terms. Flexion occurs when a movement makes the angle between two bones at their joints smaller than what it was when in anatomical position. Bicep curls require elbow flexion during the up phase. Extension is the opposite action to flexion. Extension involves widening an angle between two bones. Bicep curls require elbow extension during the down phase. Abduction occurs when a movement is away from the midline of the body, such as moving your arms from anatomical position until they are horizontal. Adduction occurs when a movement is towards the midline of the body, such as moving your arms from a horizontal position back to anatomical position. Circumduction occurs with a movement in a circular direction. A backstroke swimmer will move their arm via circumduction. Pronation occurs when the palm of the hand is turned inward. Your hand has to be in pronation or palm down to do push-ups. Supination occurs when the palm of the hand is turned outward. Your hand has to be in supination to receive change from a cashier. Plantar flexion occurs when the toes are pointing downwards towards the ground, such as the action required to accelerate a car or the up phase of a calf raise. Dorsiflexion occurs when the toes are pointing upwards towards the knees. Walking on your heels requires dorsiflexion. Inversion occurs when the sole of the feet is turned inwards. Walking on the lateral aspect of your foot requires inversion. Eversion occurs when the sole of the foot is turned outward. Walking on the medial aspect of your foot requires eversion. A person lying down in anatomical position is said to be supine when lying face up. For example, lying on your back, and prone when lying face down. For example, lying on your stomach. Let's review the directional terms recently covered. Flexion, a movement that makes the angle between two bones smaller. Extension, involves widening an angle between two bones. Abduction, a movement away from the midline of the body. Adduction, a movement towards the midline of the body. Circumduction, a movement in a circular direction. Pronation, the palm of the hand is turned inward. Supination, the palm of the hand is turned outward. Plantar flexion, the toes are pointing downwards towards the ground. Dorsiflexion, the toes are pointing upwards towards the knees. Inversion, the sole of the foot is turned inwards. Eversion, the sole of the foot is turned outwards. Supine, to lay face up. Prone, to lay face down.